We will cover norepinephrine, also known as Levophed. We'll cover what it is, how it works, some indications, some dosing, and kind of things to monitor and kind of look out for. Okay, so starting off, we'll just say, what is it? Okay, so Levophed is classified as a vasopressor. So what this means is this is going to cause increase in your blood pressure, your MAP, and your afterload as well, also known as SVR. More specifically, it is classified as an alpha 1 agonist. So alpha 1 receptors, so alpha 1 is a type of receptor that is commonly found throughout your body in your vascular smooth muscle cells. Upon activation of alpha 1, you get vasoconstriction. So activation leads to vasoconstriction, which this is how you get your increased blood pressure. Along with being an alpha 1 agonist, it also has some beta 1 activation. As well. What beta 1 is, so beta 1 is found in cardiac tissue. Activation of this is going to lead to increased heart rate and increased contractility as well. I will say it is a very strong alpha 1 agonist. It is not as strong as a beta 1 agonist. Vasopressors with more beta 1 would be something like epinephrine, but this one very strong alpha 1 and does have some beta 1 activation as well. Okay, move on to what it is used for. Okay, so Levophed is pretty much used for anything that is causing hypotension that is not responsive to IV fluid boluses. So hypotension that is not responsive to IV fluids. Some examples of this could be like sepsis / septic shock. Levophed is actually first line treatment for this. First line treatment. Another thing could be like heart failure, or if it's progressed to cardiogenic shock. In heart failure or cardiogenic shock, you will use caution with using Levophed due to, like we said earlier, it increases that SVR. So due to increased afterloads, that can make it even harder for the ventricle to eject blood, which worsens your problem. So you would definitely want to use caution there. That's something to monitor for. But basically, anything that is any type of hypotension that's not responsive to fluids, Levophed can be used there. As far as dosing of Levophed, we'll go down here. It can be weight-based or non-weight-based. If it's not weight-based, it'll be something around 5 to 30 mics per minute. If it's weight-based, it will be something around 0.01 to 1 mics per kilo per minute. So this is if it is weight-based here. Depends on your facility. Your orders will look different depending on if you use the weight-based or the non-weight-based dosing. As far as things to monitor for, kind of some adverse effects would be excessive hypertension. This is just due to excessive vasoconstriction. So you'll look for things like decreased perfusion, right? Not perfusing your end organs. So you'll check like cap refill, urine output, things of that nature. And another one would be tachyarrhythmias. And this is going to be due to that beta 1 activation. And like I said, it's not as strong as beta 1 as something like epinephrine, but it still does have beta 1 activation. So that's something you want to look out for, especially if your patient is already tachycardic before you're initiating the drip. So they're hypotensive and tachycardic. Definitely going to want to make sure and look out and see if this is something, you get like little beats of VTAC or just increased tachycardia, something to always monitor for when you're starting these catecholamine drips. That's just a very basic overview there of Levophed. We'll cover, like I said, big things to know, especially if you're preparing for like your CCRN or something. It's an primary alpha-1 agonist. Remember, it's the first line treatment for sepsis. Can be used pretty much anything, any indications of hypotension. Your dosing can be weight-based or non-weight-based, and we're going to monitor for excessive hypertension due to that strong vasoconstriction, and also tachyarrhythmias due to that beta 1 activation. Appreciate y'all watching. If you learned anything, please like and subscribe to the channel.